Hello, my name is Billy Mullins. This is my research thread for historical professions for Liberty University. I'm going to conduct my thesis research into probation and parole, specifically in the state of Virginia, and I would like for it to be based around the success or failures of evidence-based practices. As a former 10-year probation and parole officer who's a current high school history teacher, I feel like this is going to lend well into my background as I'm already able to conduct multiple interviews with current and former officers who have lived through this transition period in Virginia, as I did coming into the officer position myself, to where it went from more of a bean counter type of supervision to where you're just seeing probationer X once every 3 months. Your drug screening probationer X, once every 3 months, no matter of their risk factor or of their current status. You're not taking into account any other factors that come into play. Several years ago, probably about 10, 15 years ago, the state of Virginia introduced what was called evidence-based practices into community corrections. They did it in institutions, which would be the prison side, as well as the community corrections, which is the probation and parole side, the area that I primarily worked in. And these factors, or these new programs, were met with a lot of hostility by some of the older officers and embraced by some of the newer officers, and there was a lot of back and forth in terms of their actual success or failure. How much does officer opinion, how much does officer experience come into play in how to deal with an offender, and the appropriate supervision level and the appropriate level of treatment that they should be getting and should be receiving. So this is the thesis track that I would like to pursue, even without I haven't specifically narrowed down fully the topic. And in researching for this thread, going through some of the databases of similar theses or paths, I found two of them. One by Stan Brandon called Exploring the Lived Experiences of Probation Officers' Efforts to Reduce Recidivism. This one I found was fascinating because this gentleman who wrote this was, or maybe currently still is, a probation and parole officer like myself. So he conducted this study through interviews primarily of 11 current working probation and parole officers about how their efforts either went to reduce recidivism, how much the offenders' efforts what were in reducing recidivism, what effort, what role did the efforts of probation and parole officers have within this study. I found it fascinating. I liked his methodology that he used, using primarily interviews to conduct with current probation officers and getting their opinions backed up by data in that state that he worked in. So because this is on a similar track of something I like to pursue in Virginia, I was very interested with the methodology that was used. I also found a quantitative study of probation and parole outcomes and leaders' perceptions of evidence-based practices by Maria Amala. So this was a really interesting study about evidence-based practices, but focused on the leaders, the chiefs, the deputy chiefs, the senior probation officers' perceptions of how those evidence-based practices were working or not working. Again, this was similar to the track that I would like to try and take specifically with the state of Virginia in terms of these evidence-based programs, in terms of how long you're going to keep somebody on probation, What level of supervision are you going to keep somebody on? How often are you going to see them? What kind of treatment needs to be applied to what kind of offender? Are we going to spend the same amount of time with grandma who's committed Social Security fraud and has no drug history whatsoever, as we are the former meth addict who's just got out of jail on his seventh or eighth methamphetamine charge and who has a raging drug addiction? On its surface, obviously, no. But in the past, when probation and parole were primarily bean counters, you've seen offender X so many times in a calendar year. You went to their home so many times in a calendar year, no matter what their level of supervision was. Virginia's particularly has gone away from that. So now, if you're granny on Social Security with welfare fraud, and I had a few of those, we can put you on a phone system where you just check in electronically, and we're not, other than verifying your home one time, we're not coming over and we're not spending any more time with you than we have to. Versus if you are that dangerous or violent meth addict who is at risk, high risk of recidivism, we may be seeing you weekly. We may be seeing you coming to your house 2 and 3 times a month. Random drug screens may and will be a whole lot more intensive. And part of that in the state of Virginia, specifically in the office I worked, was based on scoring, based on how the offender's criminal history went, along with how they scored on mental health and other assessments. But it was also based on officer discretion. If I ever had somebody who scored what was called low on a case, but I knew this individual was a massive drug addict. He was at high risk of recidivism. He was possibly a risk to himself and public safety. My supervisors always give us the call to be able to override that, and I always did that. If you had a severe history of IV drug use, I'm going to be seeing you more often because that's going to be better for you. That's going to be better for me and public safety as well. So all these factors kind of go in together to help make these decision-making processes. So being able to look at these 2 different research tracks, one by a former probation officer himself, was fascinating, and I thoroughly enjoyed it. Thank you for your time. Have a great day.